Urinary tract infection. The best treatment options. A bladder infection, also known as a urinary tract infection, UTI, can occur when bacteria grow uncontrollably inside the bladder. This type of infection can affect anyone, but it most often occurs in women. A bladder infection can usually be eliminated successfully with a combination of medical treatments and home remedies. Antibiotics and pain relievers are common medical treatments for bladder infections. Some helpful alternative treatments include drinking more water, urinating frequently, and applying heat. Practicing good hygiene and making certain lifestyle changes can help prevent future bladder infections. Bladder infections are also called urinary tract infections. They can develop when bacteria enter the urethra and travel up into bladder. The urethra is the tube that takes urine out of the body. Once bacteria go into the urethra, they can attach to the walls of the bladder and multiply quickly. The resulting infection can cause uncomfortable symptoms such as sudden urges to urinate, pain while urinating, and abdominal cramping. These symptoms may be eased with a combination of medical and home treatments. Here are some of the most effective bladder infection remedies that you can try today. Drink more water. Frequent urination. Pain relievers. Heating pads. Appropriate dress. Cranberry juice. Tests and diagnosis. Tests and procedures used to diagnose urinary tract infections include analyzing a urine sample. Your doctor may ask for a urine sample for lab analysis to look for white blood cells, red blood cells, or bacteria. To avoid potential contamination of the sample, you may be instructed to first wipe your genital area with an antiseptic pad and to collect the urine midstream. Growing urinary tract bacteria in a lab. Lab analysis of the urine is sometimes followed by a urine culture. This test tells your doctor what bacteria are causing your infection and which medications will be most effective. Creating images of your urinary tract. If you are having frequent infections that your doctor thinks may be caused by an abnormality in your urinary tract, you may have an ultrasound, a computerized tomography, CT, scan, or magnetic resonance imaging, MRI. Your doctor may also use a contrast dye to highlight structures in your urinary tract. Using a scope to see inside your bladder. If you have recurrent UTIs, your doctor may perform a cystoscopy, using a long, thin tube with a lens, cystoscope, to see inside your urethra and bladder. The cystoscope is inserted in your urethra and passed through to your bladder. Treatments. Drink water, a lot of water. This may not sound like the most extraordinary remedy, but it is one of the most important things you can do when you have a UTI. Go pee. It may sound obvious, but when you need to pee, UTI or not, do it. If you hold it in, you increase the chance that bacteria will develop and multiply and cause an infection. Drink soda. Soda as in a sugary soft drink, soda as in baking soda, that miraculous substance that can help anything from heartburn to, of course, UTIs. Enjoy parsley water. It makes a wonderfully refreshing after-dinner drink. Parsley water can help relieve a urinary tract infection and speed up the healing process. Chew some celery seeds. Celery seeds also act as a diuretic, due mainly to one of the constituents of celery oil, butyl phthalate. If parsley water just isn't your thing, chewing a handful of celery seeds can help increase the production of urine. Cucumbers. This is an easy one for me. I love cucumbers. I don't know why, but they're one of my favorite snacks. Use heat. It's not just peeing that hurts when you have a urinary tract infection. The inflammation and irritation can cause a constant, nagging discomfort that makes you feel painfully cramped up. Ginger tea. Its chemical makeup allows it to block prostaglandin synthesis, a process which creates little messengers. Cranberry juice. Cranberry juice is a bit further down than you might expect on a list of home remedies for a UTI, but its helpfulness is not set in stone as much as people seem to think. Blueberries. Blueberries are from the same genus as cranberries, Vaccinium, and may also help ward off potential UTIs by affecting the fimbria of the bacteria trying to attach itself to the urinary tract. Blueberry juice isn't as easy to come by as cranberry juice.